Welcome to our channel. If your health insurance claim has been denied, don't give up. Follow these step-by-step instructions to appeal the decision and potentially get your claim approved. Step 1. Review your denial letter carefully to understand the specific reason your claim was rejected, whether it's due to lack of medical necessity, coding errors, or policy exclusions. Step 2. Check your insurance policy documents to verify whether the denied service should actually be covered based on your plan's terms and conditions. Step 3. Contact your healthcare provider to obtain detailed medical records, doctor's notes, and any documentation that supports the medical necessity of the treatment or service. Step 4. Request a letter from your doctor explaining why the treatment was medically necessary and how it relates to your diagnosis and overall health condition. Step 5. Write a formal appeal letter including your policy number, claim number, the reason for denial, and a clear explanation of why you believe the claim should be approved. Step 6. Attach all supporting documentation including medical records, doctor's letters, test results, and any relevant medical literature that supports your case. Step 7. Submit your appeal within the time frame specified in your denial letter, typically 30 to 60 days. Send it via certified mail with return receipt to prove delivery. Step 8. Follow up regularly with your insurance company to check the status of your appeal. If the internal appeal is denied, request information about external review options through your state's insurance department. Don't forget to like this video and subscribe to our channel.